You're good.
All right. Hello, everyone, and welcome. My name is Jenny Beaver, and I'm the CEO of Fourth Trimester Arizona, a grassroots 501c3 collaborative of parents, families, health professionals, educators, and local organizations. We're on a mission to change the culture of parenting so no one has to do it alone. Thank you for joining us today for our very first Fourth Trimester Ecosystem Lunchtime Conversation. Go ahead and switch to the next slide. For those of you who may be less familiar with Fourth Trimester Arizona, I'll begin with just a brief introduction of our organization. We connect maternal and child healthcare providers, social support systems, and parent support groups to foster collaboration, education, and to increase access to local resources. Our programming includes three main focus areas: our monthly village gatherings or meetups for new parents, and these happen in 4 regional online places. Our annual Fourth Trimester Arizona Conference for both parents and professionals, and our newly developing Fourth Trimester Ecosystem Initiative for all who care for pregnant women and new mothers and their babies. The goal of the Fourth Trimester Ecosystem Initiative is to begin to have inclusive conversations about what is working and what needs to change to better support new families in Arizona. Next slide. We expect our time together to flow something like this. Our intention is to spend the majority of our time listening to the speakers' experiences and discussing what we heard in smaller breakout rooms. Before we get started, we want to go over a few key items to ensure everyone is able to fully participate. So during the presentation, please post all comments and questions in the chat box. We'll be monitoring the chat and responding to your comments and questions. We ask that you please remain muted, except for when you're in your breakout rooms. Of course, then please unmute and join the discussion. And we request that you enable your video if you're able, especially during breakout sessions. If you run into bandwidth issues, please turn off the cameras. That may help. And lastly, we'll be recording the session, so we'll be able to provide a recording after to those of you who joined us. All right, next slide. Now on to the part we've all been waiting for. Today, we're focusing on the impact of COVID-19 on birth, and we'll hear from 3 perspectives in the following order. First, Amber Block-Zambrano, mother of 2 and licensed social worker who gave birth to her 2nd child during the pandemic. Second, Letisa Radliff, founder of PS Love Mommy, where she serves as a birth doula, photographer, and placenta encapsulator. And third, Dr. Kelley Saunders, OB GYN at Banner University Medical Center in Phoenix. A huge thank you, really from the bottom of my heart, to each of you for being willing to share with us today your experiences. Amber, we'll start with your experience as a mother birthing during the pandemic. If you want to go ahead and unmute and share with us your experience, that would be great.
Thank you. I found out I was pregnant in July of 2020. So initially I was looking for a Black birth provider and then Black birth workers. And then I was also looking for either a birthing center or to birth at home. And so in looking at the birthing centers, they weren't allowing multiple people in the room like I was able to do with my daughter. And so I think they were only allowing 1 person at most places, and at the most 2, I think it was, to be there during the birth. And then appointments, they weren't allowing anyone to go in with you. And so that wasn't an option for me. And so I ended up going with the home birth, where I got a mother's worth, a midwife, and then I also got a doula through Moonstone Birthing. And so for the and so for all the appointments, we were able to do those in home, which was amazing because not only did it have that addition of being able to be in person, have my husband and daughter there, but we also were able to have like an hour-long or even more sessions. And so that was one of the positives of that. But I did have to go in and get ultrasounds that my husband and our daughter couldn't go to, and so I would go to those alone. And then follow up with them after. And obviously, when I had my daughter in 2017, that wasn't the case. Anyone who wanted to come was able to go. And then, so for the first few months of my pregnancy, I was still working in office. I was a program manager for a few hospital programs around the Valley. And so working in a hospital, very close to COVID patients. Most of our patients were COVID at one point. And so there was the constant possibility of exposure. And there was one incident where I had come in contact with a COVID patient, like close contact in the same room within just a few feet. And so after that, my supervisor, my midwife decided that maybe it was best, and I decided that maybe it was best for me to work from home from there. And that's obviously something that wouldn't have been the case if I wasn't pregnant, wouldn't have been the case if COVID wasn't there. I would have been able to remain in office on the job. And so I started working from home from that point. And not just working from home, but that's kind of when like a strict quarantine started for me and my family, where I wasn't visiting anyone. You know, I wasn't going to the grocery store. And I'm sure we've all experienced that isolation that comes with that, or that loneliness, that anxiety that comes with being at home, not having contact with your family and friends, and especially it kind of intensifies when you're pregnant, those hormones and whatnot. And so there was that piece. And then at the time that I did decide to work from home, there was no vaccine. So there wasn't an option for someone to maybe come over. You couldn't take that risk. And so, yeah, and so there was that, the disconnect, the isolation, and then moving forward to the labor. You know, we had to be very careful with that too. And so we had, it was the midwife, the doula, the midwife assistant. I had my mom, my mother-in-law, my husband, and my daughter there for the birth. And so if they already weren't, actually, even if they were vaccinated, we had everyone get tested. And then we asked for them to quarantine as best as possible, because obviously people still work, they have kids that go outside the home for school and whatnot. And so we had to do that as best as possible. And then still masked when they came for the birth. And the home birth, it was amazing. It wasn't, there were no complications, thankfully. I know that's not the case for some people, but I'm thankful that I didn't have to transition to the hospital, because I know that some people were required to wear masks. Some people could only had to choose between their mom or their husband, or, you know, other supports. And so there was that too. And so I understand I'm fortunate in that sense. But even after giving birth, there was still that isolation. There was still that kind of, I wouldn't say lack of support, but it wasn't possible, I'll say that, to have that support that I had when my daughter was here, in terms of people coming over to see us, dropping off things like that. And so COVID really took a toll in that sense for me, in terms of not being able to have that support, more so for my mental state or my mental health. And like I said, I was just fortunate in the sense that there were no complications or further barriers that prevented me from having my support with me during the birth, or when we had the visits in the home. And so the home birth allowed me to birth at my discretion, but obviously COVID presented those limitations for being able to do some of those things that I mentioned. So.
Thank you so much for sharing that with us, Amber, and being willing to talk about, you know, a time that was really, I'm sure, challenging in lots of ways. Yeah. Thank you very much. And remember to put, if you guys have questions for Amber, remember to put them in the chat and we'll answer them near the end. Next, we'll move on to Letisa Ratliff, doula at PS Love Mommy. If you want to unmute yourself.
Hello. Yes. So I'll try to share 3. If I run out of time, just please cut me off. But there are 3 distinct stories that come to mind when I think about that intense period of 2020, being a doula. The first I'll share is, well, going into the pandemic, I was going into my 3rd year as a doula. And at that point, I had never attended a home birth. It kind of took COVID for me to book my first home birth. I'm like, okay, this is nice, you know, something that I'm able to experience, something different. This was a first-time mama And I think a lot of similar stories that doulas could share is that I had a family that they would have never thought that having a home birth was something that they would want. I think when it comes to the birth experience, one thing that COVID did was open up people's minds of other alternatives other than a hospital birth. So you had a lot more, as far as my experience, I had a lot more first-time moms reaching out and seeking either birth center or home birth. And so I booked my first home birth, and this was a first-time mom. Like I said, something that like they just were not expecting. So when it came time, so this was back in March. So we had just kind of been in it. Everyone's been quarantining. Not only was this my first home birth, this mama birthed pretty quickly for a first-time mom. I ended up having my first catch, which is like, as a doula, this is outside of our scope. We are not meant to catch, it's just not a part of our practice to be prepared to catch babies, but I like to think I'm pretty good under pressure. She was just managing so well. So I caught their baby, and I only caught their baby because her husband was like, "You got this, I'll be over here." I'm like, okay. But we had the midwife on call, on FaceTime. So she walked me through it, and it was really a beautiful experience. The family was happy, and just to get everything together last minute was something that they really needed and felt comfortable with. And so that's my one story. As far as just families just wanting to know what their other options are, seeking out midwives, seeking out doulas, wanting that extra support. A lot of people in Arizona don't have family around. They don't have that support already. So in a time where fear is a little bit more on the higher end and anxiety is setting in and you're getting ready to have a baby, it seemed like a lot of people reached out to doulas for that support, which was exciting because going into it, I think as anyone who owns a business, I'm not with the agency, I own my own practice. And so there was a little bit of uncertainty of like, are things going to slow down? At this point, I'm pretty sure hospitals were shut down. They were not allowing doulas to support their clients at this time, which was also devastating. So as far as hospital birth went, I wasn't attending as many hospital births because of that. We were limited in being able to enter into the hospitals. So one of my clients, another story is that they were birthing at a hospital that did not allow doulas. They were far along in their pregnancy where they just didn't feel comfortable seeking other care, or they were a little bit more on the high risk end. So there were some concerns there. They didn't have that option to look at a hospital or look at a birth outside the hospital. So we just prepared as much as we could. And we said, okay, let's do this virtually. I had never done doula work virtually. It's kind of hard to wrap your head around, but we did our best. We labored at home as long as possible, which is really great to have your doula there at home. This was a first-time mama also. Labored at home, got her to the hospital, literally just saw her going in active labor. She was in the hospital less than 2 hours before having her baby, which was a great accomplishment. But we did run into some things. So as she was pushing, her OB offered to give her an episiotomy, which really blew my mind because I'm like, she's kind of crowning at this point, baby's making his exit. Why are we offering this? And so I did speak up because she was pushing and she couldn't verbally say yes or no. And so I said, well, I think that's something that she did not, want to. And the OB, I couldn't see the OB, but he said, this is my client. This is my patient now. You need to stop talking. It is up to her. And I was like, and then she spoke up and said, no, I do not want this. yeah, so that's just an example of some of the things that I ran into as a doula. Overall, a lot more clients that I had the pleasure to assist during that time, and still are able to assist as they prepare to welcome their babies. And yeah.
Thank you so much, Letisa. That was really interesting. Yeah, I mean, it's interesting to hear the perspective from a birth doula. Yeah, so I'm really glad that you were able to give us those multiple different ways that you had experienced it. So thank you. Yeah. So our final speaker before we go into our breakout rooms is Dr. Kelley Saunders from Banner University Medical Center. She's an OB there, and we're so glad to have you here today to speak with us too, Dr. Kelley. So if you wanted to start, go ahead.
Hello, I'm Kelley Saunders. I am a practicing OBGYN at Banner University. My office is at Banner Women's Institute. I'm also faculty at the U of A, College of Medicine, Phoenix, and I am our associate program director for our training program for residents. So I got to see and work around a lot of moving parts throughout this whole last couple of years. So some of the biggest changes from a provider, first of all, in the outpatient setting, drastic changes. We switched quickly to telehealth and offering telehealth services, which I'm glad are here to stay, because I think this really opens up access to more people and has been a really nice thing that many people found beneficial. So that was a positive. But the biggest change was the lack of support people being able to come into the office with patients. At a big institution, we have to follow the rules that the institution and the system sets. And that it was for the safety of all, because we just didn't know in the very beginning what was going on, how best to handle things. And so we didn't have, fathers coming in, we didn't have kids running around, we didn't have doulas coming in. So it was a big difference in the office. But most notable really was the palpable anxiety and fear that our patients experienced. In the very beginning, no one knew, is this going to be like Zika, where there are potential congenital malformations and anomalies? Is this something I, as a pregnant person, am at increased risk for? And so there was just so much more anxiety, and that still continues to this day. I've seen more and more postpartum depression, peripartum depression, and anxiety over the last year than I ever had before. So there's definitely been an impact on women's mental health related to the pandemic. And rightfully so. In the beginning, we didn't know what was going on. And so we got to kind of learn and watch from the mistakes that were happening on the East Coast. In the inpatient setting, like Letisa was talking about, initially we weren't allowing anybody. There were no visitors, there were no support personnel. Luckily, our institution saw from some of the failures happening on the East Coast and in New York that we never stopped having at least one support person for our laboring moms. But that was still challenging too. Like you all talked about having to choose between maybe your mother or your partner or your doula or sister or whoever that might be. That was definitely challenging, and we were welcoming when more people were allowed back in. We have years and years of lots of data showing the benefits of having a labor support person. So that was really, really hard for many women. Luckily, we also got to see from experience on the East Coast that the separation of moms and babies was not beneficial, was not necessary, unless the mom was so ill that she couldn't care for her child. And that did happen. We saw so many sick moms, unfortunately, that we did see have to go to the ICU, or babies have to go to the neonatal ICU and have separation. Luckily, not as much as probably could have been. In the setting of your face being covered, where all you can see are your eyes, you lose that communication and that nonverbal component. So that was really challenging, and continues to be a part of our routine now that most of us have gotten used to. I think that we've learned a lot Personally, we had some family challenges during this time as well. And so I got to be the support person for a family member who just so happened to be pregnant during all of this and deliver unexpectedly and early here in Phoenix when she actually lived in St. Louis. And so she and her partner had to move in with us for the first 6 months of the pandemic because they had a really preterm birth outside of their home state during a pandemic. And so living that side of, well, you know, they can't even go together to see their baby in the NICU for fear of, you know, exposing all these other really delicate and at-risk infants in the NICU. And so getting to see all sides of it was experiences that I will never forget. And hopefully we, you know, will come out on the other side now that we have vaccines, now that we're learning more, moving back into some more normalcy. I'm excited for things. It's wonderful having dads back in the office. It's wonderful having doulas back in the hospital, moms, everyone. So it's been an experience.
Thank you so much. That was really interesting. Yeah, thank you for sharing your experience about that. I think we all, you know, none of us have gotten, so for all three of you, none of us have, if we weren't in it ourselves, and even maybe if we were, we didn't get the perspectives of all the people, you know, involved. So I'm really delighted that we were able to have you all here today to kind of kick off this discussion and begin to really have conversations about what that was like for families in our state. So thank you so much, Dr. Saunders.
Thank you.
Yeah. So we have a quick 5 minutes or so. Actually, I think it's 10 minutes for Q&A. And so if you've been asking questions during the presentation in the chat, maybe Elizabeth, could you please read some of the questions from the chat thread for us?
Of course, I'd be happy to. So I think our first question is from Eileen, and it's for Letisa, I believe. And so when you were supporting your moms as a birth doula virtually, what was that like? Could you give us a better picture of how you were able to bridge that?
Yes. So for me, right? Okay. So the one birth in the hospital was virtual, where I was on FaceTime. I know someone asked if I was on FaceTime. I'm sorry. Yeah. So yes, I was on FaceTime. But, you know, dad was holding the phone. He's not able to, you know, he's occupied. So I couldn't really get a good view, but they could hear me, which, you know, they were glad with. And then I usually do prenatals, 2 prenatal meetings with my clients. So the first one was virtual. In the beginning, everything was virtual. All of our meetings were virtual until the birth. And then when things kind of started to, you know, open up a little bit, I did consultations virtually, the first prenatal visit virtually, and then the second prenatal in person, which usually happens within a month of my client's due date.
Wonderful, thank you.
Mm-hmm.
So another question we have is from Jill, and she asks Dr. Saunders, what are the challenges of doing telehealth versus in-person prenatal visits? And is there anything that you feel that can get missed more easily with having those telehealth visits?
Good question. So we conducted ours with both audio and video, which provide so much more than just, say, a phone call. Luckily, these days, we have access to other things that can really help collect the data points that we're worried about, say, checking a blood pressure or a weight. And so there are virtual opportunities to collect those data and techniques that we use, or outside resources to help gather those. There's obviously time when you just have to be in person. As a gynecologist, I can't do a lot of my examinations and things over the video. That's just not acceptable. So there are things that people would still have to come in for. But for times in which there were no labs, there's no ultrasound, there's no exam required, then it really was very feasible to do with a video, and really allowed, actually, I found, for more time for conversation and education and communication, because we didn't have all of the extra stuff that happens when you go into an office for a visit, getting checked in and having your vitals and putting your urine in a cup and all of that kind of was washed away. And so it was actually a little bit easier.
Wonderful. And there's a tag on question to that as far as the aftercare. What sort of aftercare does Women's Institute provide for your birthing people?
So that also, this addition of more telehealth has allowed more frequent and earlier visits, which is something that at least the American College of OBGYNs are really pushing for the 4th trimester, and to improve access in an earlier time period after the delivery occurs than, say, the traditional 6-week postpartum visit, which we all know is just not sufficient. So having this ability really has increased access.
Thank you, Dr. Saunders. I love the fact that you are reiterating that the College of Obstetricians and Gynecology has recommended moving that 6-week postpartum visit up and being specific to the patient, right, and what their needs may be. So thank you again for highlighting that. Do we want time for one more question, Jenny, you think? Wonderful. So we have Amber, there's a question for you. It's asking, did you feel like masking made it hard to understand or express emotion back and forth as a patient?
You know, I think it definitely affected when I did have to go in a hospital and get like a ultrasound or speak to a doctor. I know that one time when I did go see a doctor, I think they assumed that I was really sad or depressed when I went in, but I was really sick. So I was really sick my first few weeks. And so they assumed that I was really sad. She just kind of asked me questions along those lines of, you know, was this pregnancy wanted? Like things like that, where I think she kind of assumed I was sad when I was really just nauseous and not feeling well. But in terms of my midwife and my doula, I think that we got to a point, actually after the first visit, I think it was where we kind of knew each other. And so we were able to read those expressions through the mask. But, you know, obviously when I'm going in to see doctor that I've never seen before, or that I've saw maybe once in the last 3 months, there's not that relationship there. So there's definitely miscommunication sometimes in terms of them being able to read what I had going on.
Thank you. Thank you for that. Elizabeth, are there any more questions?
Selfishly, I have one more question that I was hoping to ask either, I guess it could be Letisa or Dr. Saunders or even Amber. I mean, you have experience with other moms, but I'm curious with the backdrop of heightened anxiety with COVID, if it's, I know Dr. Saunders mentioned the mental health aspects of that, but did we also see that manifest itself in the physical aspects as far as hypertension or other complications to pregnancy?
Not firsthand that I've experienced, but I've had the pleasure of working with different home birth midwives. And I think one of the things I was actually asking a home birth midwife that I've attended several births with, I was asking her, like, what has she seen that has like changed since COVID? And she said, unfortunately, more hemorrhaging and transfers to the hospital. And I think a part of those transfers to the hospital is because when this is your first home birth and you're one of the main reasons why you made that decision is based out of fear. Fear doesn't really have a place in a birthing atmosphere. So when you couple that anxiety and that fear, and now you're at home, it can really, you know, create some complications, not like that you're risking your health, but as far as being low risk in a home birth setting, just risk you out even in the laboring process. Things seem to take a little bit longer, you know, things come up and things happen. So those were one of the things that I just heard through the grapevine. Fortunately, none of my clients were transferred to the hospital, but that's one of the main things that I've heard.
Thank you, Letisa. Dr. Saunders, did you have anything you wanted to add to that?
Sorry, I think I was having a little bit of internet difficulty right as you were asking it, but I think the question was increased adverse outcomes related to mental health challenges because of the pandemic.
Yes, it was similar to manifestations in physical health with that emotional health driving or associated with it.
So we do know that, yes, increased stress, anxiety, both depression and anxiety can have negative outcomes on at least in the last pandemic, is especially in the postpartum period, that isolation and lack of support that a new mom may have in having a community to adjust and to learn and grow from. That lack of that support has had significant impacts on breastfeeding outcomes and increased rates of both depression and anxiety. So I don't have any specific examples of, say, increased rates of postpartum hemorrhage, but we do know that specifically stress, depression, anxiety in the pregnancy itself can lead to poor birth outcomes such as preterm birth, low birth weight. So there are data showing this from in the past, and I expect that we will see when someone looks back retrospectively during the COVID pandemic that was increased as well.
Thank you so much. Jenny, I think we're through with Q&A.
Yeah, thank you everyone for the thoughtful questions, and thank you to the speakers for sharing with us and answering these questions. I think, like I said, it's really interesting for all of us to hear your perspectives and experience, because, you know, many of us were isolated too, even if we didn't have babies. And so, you know, some of the things that we would normally be having those conversations with each other weren't happening. So this is really eye-opening. Thank you. It's time to shift to breakout sessions for deeper discussions as a community. Elizabeth, do you want to set the stage for us so we know what to expect?
Absolutely. I'll happily discuss the transition. So thank you again, Amber, Letisa, and Dr. Saunders. I really appreciate you being here. I think your views and experiences are so insightful and give us so much to think about. So we're now going to move into those breakout rooms for the next 20 minutes or so, and we're going to reflect a little more deeply on what we've heard. So how we're going to do this, I'm going to pull up my slides here so you have a visual to go with my discussion. Oops, let me move you. There we go. So we are going to be randomly assigned to one of the breakout rooms so we will all enter a breakout room with a pop-up that's gonna let us know we're gonna go. In each breakout room, we're going to have a moderator that already knows who they are, so that's wonderful. And they're going to begin us with introductions. And then we are going to also introduce our scribe or our note taker, who's going to be just keeping track of what was discussed so that we can compile that and then send that to you later in our follow-up email after this discussion series. When we come back and we reconvene, we're going to have a few moderators, or actually all the moderators that are going to share one key thought or something that was discussed in their rooms. So with that, I expect to see a pop-up with your breakout room. And then as we're in there, we'll see some pop-ups with friendly time reminders too.
Awesome. Yeah, and I am going to stop recording and log off Facebook Live real quick.